Welcome to DermWire News, powered by DermWire.com. DermWire News for Smart Speaker is made possible with advertising support from Ortho Dermatologics. I'm Stephanie Talea with Practical Dermatology magazine. A new retrospective study shows a high cure rate exceeding 97% among older patients being treated for basal cell carcinoma and squamous cell carcinomas on their lower extremities with SRT-100 superficial radiation therapy from Sensus Healthcare. The study was published in the February issue of the Journal of Drugs and Dermatology. When treating NMSC of the lower extremities, it is critically important to examine every treatment option that doesn't inflict more pain or add potential complications, as many of these patients are elderly and present with numerous comorbidities, says Dr. William Roth, lead author of the study and voluntary clinical professor at the University of Miami School of Medicine, Department of Dermatology. The results of this study highlight SRT as a highly effective treatment option for eliminating basal and squamous cell carcinoma lesions on their lower extremities. SRT effectively treats basal and squamous cell carcinomas without cutting, bleeding, or stitching. There is no need for anesthesia and no need for reconstructive plastic surgery. SRT-100 is FDA cleared for the treatment of non-melanoma skin cancer and keloids. The power of this technology lies in our ability to deliver a precise, calibrated dose of X-ray radiation that penetrates only 5 millimeters below the skin surface, adds Isabel Raymond, Vice President, Clinical Development, Sensus Healthcare. Dr. Roth's study demonstrates that basal cell carcinoma and squamous cell carcinoma of the lower extremities can be treated safely and very successfully with superficial radiation therapy, and that it is a non-surgical treatment option for patients who do not want surgery. The American Academy of Dermatology and the National Psoriasis Foundation have released 2 new guidelines outlining best practices for treating psoriasis with a focus on comorbidities and biologic treatment. Developed by an expert work group composed of several dermatologists as well as a cardiologist, a rheumatologist, and patient representatives, the guidelines appear in the Journal of the American Academy of Dermatology. One guideline focuses on the other health conditions that may be associated with the disease, including psoriatic arthritis, cardiovascular disease, metabolic syndrome, and inflammatory bowel disease. This guideline also addresses the increased risk of anxiety and depression in psoriasis patients, as well as the effects of smoking and alcohol consumption. The second guideline outlines the biologics' effectiveness, recommendations for their use, and potential adverse effects. Doctors should be aware of the conditions associated with this disease, educate patients accordingly, and work with those patients and other physicians to ensure that each patient receives the appropriate screening and treatment, says Dr. Craig A. Elmitz, co-chair of the work group that developed the guidelines, in a news release. Our goal in establishing these guidelines is to help healthcare professionals educate their patients on the best way to treat their disease and mitigate the effects psoriasis can have on patients' overall health and well-being, adds Randy Baranek, President and CEO of NPF. With biologics, it's important for patients to understand their potential effects, both positive and negative, says dermatologist Dr. Alan Mentor, co-chair of the Guidelines Work Group. This guideline provides physicians with the information they need to discuss biologic medications with their patients and help them choose the treatment plan that's best for them. The 2 guidelines published today are the first installments in a series of 6, with 4 other psoriasis guidelines slated for publication in JAD in the upcoming months. Upcoming guidelines will address phototherapy, the treatment of pediatric patients, non-biologic systemic medications, and topical therapy. Laser Optics Pico-Low Picosecond ND-YAG laser is now FDA cleared. According to the company, Pico-Low generates high peak power and consistent picosecond pulse duration, producing strong photomechanical forces within the skin to break down and fragment pigments, such as those found in tattoos. In addition, Pico-Low incorporates Laser Optics' patented diffractive optical element fractional technology, which creates laser-induced optical breakdown in the dermis even at a low power. Exceptionally stable energy output and picosecond pulse duration are key technological developments integrated into Pico-Low, further distancing it from the competition. High stability in both laser output and pulse duration is central to delivering consistently efficacious treatment outcomes while simultaneously minimizing patient discomfort, says C.J. Lee, CEO of Laser Optic, in a news release. Thank you for listening to DermWire News, powered by DermWire.com. This editorially independent program is supported with advertising from Ortho Dermatologics.